I'm Dr. Leo Powers, and I'm in Plover, Wisconsin. And today we'll be talking about sciatica, which is pain down the back of the leg. And it can go just right here in the butt, or it can go all the way down to the heel or part of that. And so the sciatic nerve is the longest nerve in the body, and it gets pressure sometimes from this piriformis muscle, and that goes underneath the sacrum. So this is the backside view, and then it attaches to the hip there. And most chiropractors can do all chiropractors can do the category 3 component. That's where the disc is bulged, and by adjusting that helps to take the sciatica out. And there are other categories in the technique, the cranial pelvic technique that I use. There's category 1, and category 1 is a very gentle treatment, and they're all gentle for the pelvis. And so this is a plastic spine. It's not real, but it's like a spine and pelvis. And so when you put this on the table, a lot of times if you have sciatica, you lay face down, and then you put the blocks in different positions. You might put it like here and here, or you might need to put it like this. And so that's category 1 or category 3. And then category 2, you put the blocks like this or this, or you put it like this, and then as you breathe, the pelvis actually repositions itself, so it takes the stress out. And so if all you're doing is breathing, you wouldn't think that would be that much stressful to the pelvis, and it's not. It's very gentle. And the category 1 also, you adjust each of the category 1, 2, and 3. There's a head and a pelvic component, and this shows in the head that actually as you breathe in, the head will expand out. And so, and if you watch someone, you don't really notice that the head kind of expands out like that. You don't notice that, but you see that on this here, and that actual motion is about 2 to 3 millimeters, and there's 25 millimeters in an inch, so it's a small motion, and if it's palpated, you'd be able to feel that. So the adjustment on the head for category 1 is on one part of the head. So I'm not telling you where I touch, but it's a special spot. And then what I do is I use one finger to adjust the category 1, and I put light pressure on it, and then as you breathe, it expands and contracts, over here. And so then I just put about like this amount of pressure. So it hardly moves the balloon, so it has to be, very light. And then as you breathe, it resets in there. And it usually takes, for the category 1, usually for the head adjustment, it takes about less than a minute to adjust it, and it's very gentle. So that's how that works. So anyway, so it's easy treatments, and it's gentle. And if you have sciatica, it can be very painful, and a lot of times you have trouble sitting, and a lot of times people that have sciatica will stand because that takes some pressure off the sciatic nerve that goes down the back of the leg. And I've been in practice 41 years, and I've treated it many times, and it's usually not extremely difficult. If it's the disc, it takes longer treatment, and if it's the category 1 component, it's quite a bit less visits. But we don't really know how many visits it will take till after you get treatment, but it is a gentle chiropractic, cranial, pelvic, full spinal adjustment treatment. And if you have pain down, instead of down the back of the leg, if you have pain down the side of the leg, front of the leg into the groin, that would be a different one. That's what they call category 2 stress, and that can be treated also. And a lot of times that piriformis muscle that we talked about, right right back in there, that's actually attaches to the front part of the sacrum and then attaches over here to the hip. That one is involved a lot with category 2 also. So category 2 is a nice treatment, and it's gentle, and they're all gentle. So, so that's the information about sciatica. And so whether you have pain down the leg, the front, into the groin, the side of the leg, the back of the leg, there's techniques to work on that. I'm Dr. Leo Powers in Plover, Wisconsin, and I hope you have a great day.